Welcome to Conversations with the Commissioner. I'm Tom Thorpe. I'm sitting in today for Commissioner Maggie Hart Stebbins. Joining us today is Leigh Caswell. She's the director of the Presbyterian Center for Community Health at Presbyterian Healthcare Services. Welcome.
Thanks for having me.
We're going to talk today about, and we talked briefly, a term that I hadn't really heard before, and we're talking food insecurity. What does that mean?
That means not necessarily that you don't have food every day, but that you regularly don't know where your next meal might come from. And you're having to make difficult decisions about spending money on food or spending it to pay your utilities.
Is this, we're talking all people, regardless of age, or is it based more on income level? Where do we see this come from?
I think it's often income, but it can also be access. Another term that we talk about is food deserts. And in New Mexico, we have a lot of food deserts. So people just don't have access to the food. There's not a grocery store in their neighborhood, or what's there is not healthy, or it's too expensive.
I guess my next question then would be, why are healthcare providers getting involved in this? Where do they come into the mix?
Yeah, absolutely. So we know more and more that the food you eat is really going to impact your health. It's going to impact whether after having some illness, whether you come back to the hospital, and we want to prevent that. You know, we want people to remain healthy. We know that as a child, if you have good nutrition, that your brain is going to develop in a better, and so you're going to be more successful in your life. We know that kids need to eat food in order to show up to school and be able to learn, and that's going to impact whether they can get a job and be successful. So it's so connected also to many chronic diseases. So we are learning more and more that we need to put investments into the community to address food in a new way, food and nutrition.
Seniors in this as well?
Absolutely.
Okay.
Yeah, absolutely.
Now, you guys started a pilot program in May, food pharmacy. Explain that to me.
Yeah, so the food pharmacy is a place where somebody can go once a week and they'll get free access to fresh fruits and vegetables and other healthy staples. And their provider is going to refer them to that site based upon their answer to a couple of questions about whether they have enough food to eat. And if it's somebody that they think is really struggling to access food, they're going to refer them to the food pharmacy. So we started out with 50 referrals. We're just testing it out to see how many people show up. Can we handle everyone coming in? And so essentially they come every week, they get nutrition counseling, they leave with about 17 pounds of food, and we've partnered with Roadrunner Food Bank. We're purchasing the food from them. It's all at no cost, and we'll be able to see whether their health outcomes improve after participating in this pilot.
So they have to go through their healthcare provider to get into this program?
Yes, yes.
And why is that? I mean, we publicize this, people are going to show up wanting food,
yes.
but they need to go through the program.
Yeah, we have a lot of other initiatives focused on increasing access to healthy food in the community that are not connected just to our patients, but we're learning more and more we have to have outcomes. We need to show outcomes for our programs, right? And so and our providers really want more tools for their patients as they recognize food insecurity more. So we are, in this instance, just looking at our patients, but our mobile farmers market, you know, is for everybody in town, and there you can find really affordable, healthy food.
So where does this take place right now? How do you have it set up?
It is near our Caseman campus at Wyoming and Constitution, and we identified that there we have our emergency department and also our internal medicine clinic, and so we have a lot of seniors that go there. And so we are working with specific providers to do the referrals, and then we call and remind people the day before or the day of and we're often learning that we have to help people with transportation as well. And we're finding that the impact is more than just giving people food, but that a lot of people don't have a huge social support network. And so they're really excited about talking to people, meeting new people, sharing information about their lives and building relationships, these things that we know impact health, but we're not very good at providing or measuring. So we're really happy to learn that the impact is going to be greater than just increasing access to food.
And once they're referred to this by their physician, I'm assuming they have to go back, there's checkup involved, conversation that takes place about how this works, and not only for the patient's benefit, but for you guys to find out whether this really works or not.
Yes, absolutely. And we're utilizing a care team member called a community health worker, and they're really the ones facilitating the referrals and communicating with the provider and to the patient. And that person is a lay health worker, so they're not necessarily clinically trained, but their role is focusing on these types of resources: food, transportation, housing, utility assistance. And so they're really our go-between in this program.
So for people who want more information, how do you go about finding out about this program? Not only the food pharmacy, but maybe finding the physicians that participate in this.
That is a great question. I think right now, if you see a Presbyterian provider, you could ask them about it. You can also look at the phs.org website and find the contact information for community health. And you can see a whole range of our programs on that website.
So you have information out there available, flyers or something for people that they can see and find this?
Yeah, we're not really advertising this program, but we do have other programs that we are advertising, like our free healthy meals program. That's one where anyone under 18 could show up to 5 of our hospitals across the state and receive a free meal. And that program, we want as many people to utilize as possible.
Great. Well, this is fairly fascinating. I hope this really is successful and works out, and we appreciate you coming in and talking to us about this and spending your time.
Absolutely, thanks. Us too. We really hope we can expand in the future once we learn how this first pilot goes.
All right, thank you. And thank you for joining us. This is Conversations with the Commissioner. I'm Tom Thorpe, in for Commissioner Maggie Hart Stebbins. Thank you.